Have you ever experienced a sudden impact to your, perhaps during sports or an accident, and then noticed a reddish tinge or even visible blood collecting in the colored part? It can be alarming to see something like that in such a vital organ. You might wonder if it will just heal on its own or if it is something more serious. Let us be very clear, a hyphema, which is blood in the front chamber of your eye, is always considered an ocular emergency. This condition requires immediate evaluation by an eye care professional, as it can lead to serious complications if not properly managed. Do not delay seeking help. The primary reason a hyphema is so serious is the risk of increased intraocular pressure, essentially high pressure inside the eye. This rise in pressure can damage the optic nerve, potentially leading to glaucoma, a condition that causes permanent vision loss. Another critical concern is the possibility of rebleeding, which often occurs a few days after the initial injury. A second bleed is typically more severe and carries a higher risk of complications. The blood itself can also stain the cornea, the clear front window of your, causing long-lasting vision impairment. Furthermore, the presence of a hyphema signals that the eye has sustained trauma, and there may be other underlying injuries to discover and treat. If you suspect a hyphema, the most crucial step is to seek emergency care without delay. While waiting for professional help, avoid rubbing or pressing on your injured. Try to keep your head elevated to help the blood settle and reduce pressure. It is also important to refrain from any strenuous activity, as this can increase the risk of rebleeding. Your eye doctor will conduct a thorough examination and may prescribe medications to reduce inflammation or control eye pressure. They will also advise you on rest and activity restrictions. Even a seemingly small amount of blood can have significant implications. The severity of the hyphema, from a tiny crescent shape to a completely blood-filled chamber, guides the treatment approach and predicts potential outcomes. A particularly severe case, where the entire anterior chamber is filled with blood, is sometimes referred to as an 8-ball hyphema due to the eye appearing uniformly dark. Eye care professionals will closely monitor the rebleeding risk and watch for signs of corneal staining, which is when blood pigments seep into the corneal tissue. Understanding these nuances helps ensure the best possible long-term vision results. Swift action upon discovering a hyphema is paramount for preserving your vision. Recognizing this as a true eye emergency and promptly consulting an eye care professional ensures that potential complications like glaucoma, corneal damage, and permanent vision loss are identified and managed effectively. This proactive approach safeguards your sight and promotes the best possible recovery from an eye injury.